Hi class, this is Professor Harmony Kim, and this video is for the lecture of Pastoral Counseling for Buddhist Ministry in week 6. The Buddhist chaplaincy or healthcare chaplaincy are certified by the Association for Clinical Pastoral Education in the world. Clinical Pastoral Education is abbreviated in CPE. And they are working as a chaplain and supervisor at various hospitals. The statement in this slide implies the significance of the role of chaplaincy like that. Do not close your eyes before suffering. Find ways to be with those who are suffering by all means, including personal contacts and visit, images, and sounds. By such means, awaken yourself and others to the reality of suffering in the world. The religious tradition we now call Buddhism evolved out of the Buddha's enlightenment and the Buddha's realization that each of us is already perfect and complete, lacking nothing. At the same time, the Buddha understood that this was not something that could be taught. In other words, each person must realize it for him or herself. Why would a Buddhist be at all interested in taking up chaplaincy, especially since Buddhism does not take up the question of whether there is a God? Clinical Pastoral Education, CPE, introduced that chaplaincy and Buddhism are a beautiful and perfect match. Buddhism abides in impermanence and points to the interconnectedness of all things. Its teachings and practice guide one toward being aware and awake in every moment. One awakens to the realization that there is nothing outside of this very moment. The past has already happened. It no longer exists. The future has yet to happen. It too does not exist. There is only now, and this now is totally alive and filled with all possibility. The practice of Zen Buddhism asks practitioners to take the path toward becoming a bodhisattva. Bodhisattvas live their lives imbued with compassion for all beings without exception. It demands that each one of us realize that the separation between oneself and others is an illusion, and that causes a great deal of suffering in the world. All of these perspectives of Buddhist thought are meaningful to and actively practiced in chaplaincy. Patients will ask each of us to see them, to hear them, and if possible, to step into their suffering so that we might be able to feel them. They endlessly reveal to us how sickness, old age, and death have become a reality in their life. Their illness demands that we let go of our own fears. As chaplains, we are being given the opportunity to experience intimacy, empathy, and compassion. The cries of these patients touch our hearts and minds directly, and we realize these human voices as none other than our own. The story of Buddhism begins with Shakyamuni's foray outside the protected walls of his kingdom. Inside the kingdom, he had been comfortable and removed from the world and its problems. Shakyamuni was shocked to discover sickness, old age, and death in the people he made contact with. This face-to-face teaching and his insight into the reality of suffering transformed his life. Starting with his first sermon on the Four Noble Truths, the Buddha spent the next more than 40 years expounding on the realization he had experienced. The Buddha was referred to in his time as the great doctor or healer. His healing pointed people to the present moment, and he used whatever means he could to guide the students toward this here and now of their life. The Four Noble Truths are: life is suffering, there is a cause of suffering, and that cause is attachment or clinging. The third noble truth is: if there is a cause, then there must also exist an end of suffering. The fourth noble truth is: the guideline to end this suffering were presented as the Eightfold Path. Following a path of right mindful thought and conduct. The Buddha was creative in his pedagogy, and the Buddha used a medical analogy to explain to his students how they should engage the Four Noble Truths. The Buddha likened the dysfunctional aspect of human attachment to a disease, and he likened the Dharma to medicine. With this analogy as a basis, the Buddha went on to pair the Four Noble Truths with the following process, defining how a spiritual seeker should engage these truths. The analogy of the first Noble Truth is: diagnose the disease. The chaplain or caregiver needs to be awake to whatever presents itself to him or her without needing to fix or to cure or change the patient in any way. The medical disease is just a part of the dis-ease of suffering. The chaplain will journey where the patient needs to go. This could be the fear of the unknown, the loss of independence, the worries around their diagnosis, the loss of hope or meaning, etc. The analogy of the second noble truth is identifying its cause. The chaplain or caregiver will be curious and wonder about what this patient might be clinging or attached to. And this is producing suffering for him or her. This could be the why me question, or feeling abandoned by God or friends, or feeling lost or depressed, or possibly angry at the situation or diagnosis, etc. The analogy of the third noble truth is determining whether it is curable. Is the patient be able to touch, share, or sit in their suffering and reflect on or explore it, or is denial or resistance to being present to their thought and feelings too difficult in this moment? The analogy of the fourth noble truth is outlining a course of treatment to cure it. The Buddha realized the uniqueness of each person and that even the Buddha could do no more than guide each person toward realizing that the answers or healing cures rested within each of them. The Buddha taught by many methods such as story, question and answer, as well as through meditation, contemplation, and modeling. The Buddha taught about compassion and wisdom and employed these four noble truths as the foundation of his teachings. So let's look at these truths in relation to chaplaincy and caregiving. The first noble truth reflects the fact of suffering. This truth states that the problems of life, especially the human experiences of birth, old age, and death, are inevitable. These experiences confront us with our transient nature. The desire to cling to what was or what might one day be has created great suffering. However, there is a difference between pain and suffering. The Buddha taught that pain is a specific response of the mind to the actual physical wound to the body in the present. Suffering, on the other hand, is past or future oriented, a response of the heart or mind to an imagined loss. For example, whether it is a physical loss like losing one's youth, or a mental loss like that belongs to me and I'm afraid to lose it. Looking to a future of inevitable loss, we cling to what we are afraid of losing, and the result is suffering. The first noble truth reminds us that life is constantly changing and we will become sick, get old, and die. The realization of my own human condition helped open my eyes and heart to the suffering of others and inspire me toward chaplaincy and continues to motivate me as a supervisor who is teaching the art of chaplaincy to those who will come into contact with these first noble truths in their patient. These patients live and fully embody this first truth. Most patients are stripped of all that was once familiar and secure, and the core foundation of their lives are shaken. Patients become unveiled, raw, and vulnerable. As a matrix for learning these truths, there is no place more powerful and no teacher more direct than these patients. Chaplains and caregivers come face to face with this reality, and it holds the potential to deeply affect their life and practice. The second noble truth reflects the cause of suffering. In his presentation of the second noble truth, the Buddha taught that all suffering has its origins in craving, also called attachment or desire. We crave and slavishly cling to a variety of things. There is a craving for sensual pleasure, craving for existence, and craving for self-annihilation. Our desires also have a cause, and that cause is a basic, fundamental ignorance regarding our world and our place in it. These desires can be great motivating forces as well as great blocks along our path. In psychology, we label these blocks as resistance and then work to resolve them therapeutically. However, in Buddhism, we honor the resistance and aim to bring the student into greater awareness of it and explore our part in its creation. Clinical Pastoral Education, CPE, allows students to explore what they cling to and why they are attached. We explore whatever stops us from being authentic, and we reflect on the layers of conditioning that have obscured our natural perfection and wholeness. In chaplaincy training, students are taught that caregivers can only be empathic with another to the degree that they have accessed all their thoughts and feelings within themselves. The third noble truth reflects the cessation of suffering. This truth says that there is always the possibility of putting an end to suffering. It teaches that as long as we cling to our three poison, such that attachment, hatred, and delusion, and as long as we are bound to the endless cycle of birth and death, we will continue to suffer. The Buddha said that the way to put an end to suffering is to realize our true nature. What is true nature? To describe this true nature, I will use the metaphor of the ocean. So the ocean implies divine presence, or God, or absolute. Let's say that the whole universe is a boundless ocean. Each of us can be seen as a distinct and unique wave arising from this ocean. When we take birth as this wave, we at first remember that we are none other than the ocean, and the ocean is just us. We experience no difference. As we get old, we begin to invest in and believe our own individual waveness to be separate from the great ocean. This awareness of a separate self produces a longing to return as well as a fear of what one might lose in this process. We feel alone and isolated from that which nourished and gave us birth. The more we believe in our separateness, the more we suffer. If we just for a moment can let go and experience or remember our oceanness, then in that moment we are free to experience all waves as none other than ourselves, and ourselves as all beings. Meditation is used in helping to recognize and experience this oceanness. Sitting for many years, practitioners began to get a glimpse into the vast oceanness of each one of us. This is called seeing clearly into your true nature. That nature is described as shunyata, or emptiness. Empty of attachment, empty of hatred, and empty of delusion, and even empty of substantial self. This stateless state of non-being is described in the Heart Sutra as having no eye, no ear, no nose, no tongue, no body, and no mind. Even no realm of sight, no realm of consciousness, no beginning, and no end. It is recommended that students develop awareness of their pastoral identities and how this affects patient. Guide patient toward paying attention to the feelings and thoughts that are present in each moment, and help them reflect on where and why they become stuck and experience suffering along their pastoral journey. Chaplains work together to step into the shoes of the others and reflect on where we separate ourselves or refuse to access certain feelings or thoughts that our patient might have. The Buddha defined this as compassion and taught us how to live our lives out of this realization. The fourth noble truth reflects the way to end suffering. This truth defines the Buddhist way of life and contains all the moral and ethical teachings and practices within Buddhism. It attempts to draw up a how to relieve suffering workbook, which allows the student to lead. Basically, the fourth truth describes how one might live a compassionate life in community with others. It looks at how we separate ourselves from the present and shows us the way to return. It points to right here and right now, and it shows us how to wake up to our lives again and again. We learn to be aware, we learn to let go, and we learn to trust our beingness, such as ministry of presence. This fourth truth puts a great emphasis on living actively and compassionately in the world and how to relate intimately with others. In this context, Dozen Zenji stated that life and death appear in each moment. They appear instantly and naturally without thought. Every moment contains total reality. In the hospital, clinical pastoral education (CPE) students come face to face with patient after patient. That life is suffering is no longer a simple idea, something to dwell on during seated meditation, but it is the actual nature of their lives. There is a cause of suffering. The second noble truth takes on a flashy meaning as the students explores the spiritual suffering along with the patient. And this suffering comes from clinging to life and fearing death. The cessation of suffering, the third noble truth, is an opportunity for the student to let go of their separateness and to experience the possibility of being at one with or intimate with each patient. Looking at one's own mortality has always been an essential part of Buddhist practice. We sit for many years looking directly at the nature of death and what contemplating mortality brings up in each of us. The path is the fourth noble truth and was part of the inspiration behind the creation of the New York Zen Center of Contemplative Care. I'm going to briefly introduce New York Zen Center of Contemplative Care for those who are interested in chaplaincy or caregiver programs. The co-founders of New York Zen Center are Koshin Pali Ellison and Robert Chodo Campbell and 3D Jinpu Hirsch. They create a community of dedicated practitioners who also practice as caregivers. The teaching staff are dedicated to be of service to others, and they guide students toward realizing their authentic and complete and perfect natures. They are building a community that is founded upon compassion and service. Most of the students are being trained in hospitals and within hospices. These students have courageously faced and embraced their patients' suffering and have allowed these emotional and rich relationships to guide, teach, and transform their own lives as well. Clinical pastoral education for Buddhists first began around 10 years ago at Beth Israel in New York City. Students were asking for ways to make their sitting practice real, and they were excited about having the opportunity to engage their practice with the patients in the hospital. Clinical pastoral education explore meditation, visualization, and relaxation as among the many tools chaplains can offer to particular patients. Students learned to listen with their whole body and mind, and students work with the patient, trying out ways to use breathing to alleviate pain and distress. Students look at ways to meet the energy level of the patient and expanded on the use of observation and mindfulness. It is emphasized that students be aware of their own feelings and those of their patient moment by moment. Clinical pastoral education emphasizes the action, reflection, action model of education. And this model works beautifully with the training that Buddhist students practice on the cushion. In clinical pastoral education, students begin to come face to face with suffering as they explore intimacy with their patient. This suffering puts students in touch with the questions of life and death and the impermanence of things. They learn to enlarge their sense of self and to understand themselves in relationship to others. As their defenses drop away, they become more open to the myriad teachings that present themselves moment after moment. They begin to see where they draw their boundaries and where they refuse to go. They have the chance to minister to the sick and dying, and in so doing, minister to themselves as well. Quite a few students have continued in chaplaincy. Many have returned to their sitting practice with renewed energy and vigor as a result of the work they have done with their patient. It is very grateful to be able to offer other Buddhist practitioners a way to make their practice come alive, which is a way to realize the Four Noble Truths as a living, breathing reality. I am introducing a chant that is recited in the Zen meditation hall. Let me respectfully remind you, life and death are of supreme importance. Time swiftly passes by and opportunity is lost. Each of us should strive to awaken. Take heed. Do not squander your life. Quiz 1. As long as we cling to our attachment, hatred, and delusion, we are bound to the endless cycle of birth and death. Is this statement true or false? Quiz 2. In the Buddha's pedagogy, by using a medical analogy, which of the following noble truths is equivalent to diagnose the disease? First, second, third, or fourth noble truth? You know the answer. As a routine process, you will submit quiz answer, including your option name, to my email address. Please include your last name, comma, followed by first name, and quiz answers. The due of this assignment is until May 15, Sunday midnight. This is the end of the lecture.